Let's do a case study on organ donation within the critical care settings. For this case study, we have Miss Sarah Marshall. She's 45 years old and has a past medical history of hypertension, type 1 diabetes, and a recent ischemic stroke. With her current status, Miss Mitchell was found unresponsive at home and transported to the ICU. Imaging confirms an anoxic brain injury due to prolonged cardiac arrest. After 72 hours of observation and testing, she's been declared brain dead. Mrs. Mitchell's family, including her spouse and two teenage children, are struggling with the decision about organ donation, and they have questions about the process and what it entails. We've go over the next slides. We've got several questions in 5 parts. Why don't we take 15 minutes, go ahead and answer these for yourself, and then we'll go through each slide and go over the answers. I'll go ahead and leave it running so we just have a good timer on the clock. We will resume with the answers at exactly the 15-minute mark. That is the 5 minute mark, so 10 more minutes. Feel free to send me an email or any feedback if you feel like I'm giving you too much time or not enough time to complete these as well. All right, we're just past the 10-minute mark, so a little less than 5 minutes. We'll get started with the answers. All right, just past the 13-minute mark, wrapping up. Got about a minute and a half here, and we'll go over the answers. All right, that is the 15-minute mark. For part one here, what criteria must be met for a patient to be declared brain dead? Brain death requires the absence of brainstem reflexes, unresponsiveness, and apnea. The diagnosis must be confirmed through clinical evaluation and, in some cases, ancillary tests like an EEG or cerebral blood flow studies. For question two, what steps should the nurse take to support Mrs. Mitchell's family during this process? The nurse should provide clear and compassionate communication. Answer questions honestly, and offer emotional support, and involve the Organ Procurement Organization, the OPO coordinator, early in the process. And finally, 3. How does the Uniform Anatomical Gift Act impact organ donation decisions? The UAGA establishes the legal framework for organ donation and ensures that Mrs. Mitchell's prior consent for organ donation, if documented, is honored, and guiding the discussions with the family if no prior consent exists. Here for part 2, what is the nurse's role in collaborating with the OPO? The nurse's role includes early identification and notification of potential donors, maintaining the patient's physiologic stability, and supporting the family during the discussions with the OPO. For question 2, how should the nurse approach communication with the family to discuss the option of organ care donation? The nurse should approach the family with empathy, use clear, non-technical language, respect cultural and personal values, and ensure that discussions focus on the potential to honor the patient's wishes. And for 3, what ethical principles guide the nurse's actions during this process? Autonomy, again, honoring those patients' wishes. Beneficence, supporting the family and ensuring a positive impact through the donation. And non-malfeasance, ensuring no harm is done to either the patient or the family. For part 3, the OPO coordinator arrives to discuss organ donation with Mrs. Mitchell's family. They express concerns about her organs will be used and the impact on her body. For question 1, how can the nurse address the family's concerns about the organ donation process? The nurse can explain in respectful and dignified care provided to the donor, the rigorous protocols ensuring organ safety, and how the donation honors the patient's legacy. For question 2 of part 3, what resources or support services should the nurse recommend to help the family cope with their decision? The nurse can recommend grief counselors, chaplain services, and peer support groups through the OPO or hospital. And for 3, what cultural or religious factors might influence the family's decision, and how can the nurse ensure culturally sensitive care? Cultural or religious beliefs about the body after death or the donation process may affect the decision. The nurse should involve cultural liaisons, chaplains, and ask open-ended questions and avoid making assumptions about what care they would like their family to receive. For a quiz question, the nurse is discussing brain death with Mrs. Mitchell's family. Which of the following statements is most appropriate? Would that be A, brain death is the same as being in a coma, so there's still hope for recovery? B, brain death means there is no brain activity and the body cannot function without mechanical support? C, brain death is a temporary condition and will continue to monitor her closely? Or D, brain death only affects the brainless, so other parts of the brain can recover? And obviously that correct answer here is going to be B. Brain death means that there's no brain activity, and the body cannot function without mechanical support. The body is being kept alive without any consciousness, any brain activity present. And wrapping up, Ms. Mitchell's family consents to organ donation. The medical team initiates protocols to maintain organ viability until procurement. First question, what interventions are necessary to maintain the viability of Ms. Mitchell's organs? And that answer is going to be interventions like maintaining hemodynamic stability with fluids and vasopressors, ensuring adequate oxygenation, and monitoring for electrolyte imbalances while preventing infections. For question 2, describe the role of the nurse in the managing fluid and electrolyte balance, hemodynamic stability, and oxygenation. Your role is going to include monitoring lab values, adjusting IV fluids and medications as needed, ensuring the ventilator settings optimize oxygenation, and communicate any changes to the OPO coordinator immediately. And then for 3, why is it important to involve the OPO coordinator in planning the timing of organ procurement? That coordinator ensures that all logistics, including recipient preparation and surgical team availability, are there, and also make sure that they all align with the donor's physiologic stability. And for our final quiz question, the nurse observes that Mrs. Mitchell's blood pressure is dropping. What is the most appropriate action? Would that be A, notify the provider and recommend isotonic crystalloids and vasopressors? B, wait to see if the blood pressure stabilizes before intervening? C, increase oxygen delivery to compensate for the drop in blood pressure? Or D, administer a diuretic to reduce fluid overload? And that answer here is going to be A, notify the provider and recommend isotonic crystalloids and vasopressors. We want to make sure that that blood pressure stays up to keep those organs as healthy and viable as possible. But anyway, that's all we got for this case study. I'll see you in the next one.